Stand by. This is your 1 minute warning till showtime. Thank you.
Good afternoon, ladies and gentlemen. My name is Nirav Shah, and I'm the Director of the State of Maine Center for Disease Control and Prevention. I'm joined today by Commissioner Heather Johson from the Department of Economic and Community Development, Commissioner Jeanne Lambrew from the Department of Health and Human Services. And we three are here today to provide an update on the COVID-19 situation across the state of Maine for today, Tuesday, May 19th, 2020. We begin today's update, again, on a sad and unfortunate note. Maine CDC is now reporting 3 additional individuals with COVID-19 who have passed away. One was a woman in her 90s from Cumberland County. Another, also a woman in her 80s from Cumberland County. And the third was a man in his 40s, also from Cumberland County. Those 3 deaths add to our total. However, it's also important, I'd like to make one clarification, or one update rather. Yesterday afternoon, Maine CDC received some additional information on an individual who passed away and whose death we reported over the weekend. This was an individual who was a man in his 90s from Cumberland County. We received additional medical information from the healthcare facility that was taking care of this individual, and we learned that the individual, although he was positive for COVID-19, was actually recovered and released from isolation earlier in April. After that individual was fully recovered and released from isolation, he then went on to develop other medical symptoms unrelated to his COVID-19 that ultimately led to his passing. As a result of that, although there are 3 additional individuals who have passed away, that individual's death is not classified as being associated with COVID-19, and for that reason, our total number of individuals who have passed away stands at 73. Overall, Maine CDC is now reporting 1,741 cases of COVID-19, an increase of 28 cases since yesterday. Of those 1,741 cases, 1,561 are laboratory confirmed, and 180 are probable. 225 individuals have been hospitalized, and 44 are currently in the hospital. Of those 44, 19 are reported as being in intensive care units, and 11 are on ventilators. Overall, 1,088 individuals with COVID-19 have recovered in Maine, and of our totals, 386 have been among healthcare workers. I'd like to provide a quick update on some of the outbreaks that Maine CDC has been involved with and tracking very recently. The first is at the Bristol Seafood Company down in Portland. We've continued to work collaboratively with the operators of that organization, of Bristol Seafood. Additional test results came in yesterday, increasing the total number of cases at Bristol Seafood to 13, an additional 8 cases since yesterday. In addition, we've been working with the Springbrook Center, where there are now a total of 42 cases and 2 individuals who have passed away. Of those 42 cases, 31 have been in residents of the home and 11 have been in staff. We've also been working very closely with Chinbro Construction to investigate an outbreak affiliated with a work site there. As of a few hours ago, Chinbro reported to us that they will be halting all work at that site for at least several days, up to 14 days, while they increase cleaning as well as increase monitoring of individual construction workers who are at that site going forward. Based on where we are right now, the total number of cases affiliated with that site stands at 19. Maine CDC is continuing to investigate those cases to really think about 2 main issues right now. The first is, what do we know about the epidemiology of who was affected? Where were they from? And where might they have traveled from? Based on where we are right now, the bulk of those individuals who have been working at that site are from the Northeast. However, some individuals are reported to have been coming in as far as away as Wisconsin. The second area of investigation for us is, what were the conditions at that site that we can learn from that might inform other construction sites? For example, what percentage of the workers were wearing masks? And to what extent were the conditions at the work site potentially ones that could have transmitted COVID-19? Again, that investigation remains underway and we'll have additional updates as they become available. Finally, I'd like to provide an update on 100 State Street in Portland. Yesterday, right around this time, we became notified of conditions that were concerning to us, as Kevin Miller asked about yesterday. Our epidemiologists have been investigating that situation. We're aware of a number of potential cases that are associated with that facility. It's important to note that this is an apartment building with individuals who we believe to be at risk for COVID-19 who live there. We're deeply concerned about their welfare, and as a result of that, are working right now with our colleagues at Mercy Hospital, among others, to offer testing to individuals who live at 100 State Street. Much more to come on that as that process unfolds, but that's where we are right now, and we'll have additional updates as the testing is offered and completed. Next, I'd like to provide an update on our laboratory activities. As everyone is aware, yesterday we announced that we were fully online with greatly expanded laboratory capacity at Maine CDC's lab here in Augusta. Just yesterday alone, Maine CDC received 531 specimens and conducted tests on those. As the days go on and additional providers continue to send samples, we anticipate that number increasing. Overall, the total capacity at the laboratory just in Augusta stands at roughly 1,000 samples per day, or 7,000 samples per week. Turning now to our work on public health preparedness overall. About 2 hours ago, we at Maine CDC received word that we would be receiving a 3rd shipment of remdesivir from the federal government. As a recap, about a week and a half ago, Maine CDC received its first shipment, consisting of 10 cases of remdesivir, or enough for about 50 patients. A few days after that, we received word that we would be obtaining an additional 7 cases of remdesivir, or enough for about 35 patients. As I noted, we've just received word that we'll now be receiving an additional 8 cases of remdesivir, or enough for roughly 40 patients. We have not yet been informed as to when those 8 cases would be arriving. We've just been informed that they would be arriving soon. We'll follow the same protocol that we followed with the first 2 shipments in terms of allocating that remdesivir to hospitals across the state. But what I'd like to note for everybody is that the allocation decisions that Maine CDC makes there are just the first stop. As we've discussed remdesivir with healthcare providers and hospitals across the state, what we've informed them of is that our expectation is that if another hospital across the state were to request remdesivir, those hospitals can and would be able to share it amongst the healthcare systems across the state very, very easily. I say that because I just wanted to underscore that the allocations that we make are not the final destination for any of the remdesivir, but just the first stop after it leaves our warehouse. Just a couple of days ago, our medical team and I had a call with healthcare providers across the state to see how remdesivir was going and how it was being used. They reported that they have been using it, that there has been uptake of the drug across the state, and we're starting now nationally to get a better picture of what some of the remdesivir data look like. We're hoping that as we receive additional shipments in Maine, that will add to the armamentarium that clinicians have available to them to help take care of patients across the state. Finally, just a couple of updates on the fit testing front before I turn things over to Commissioner Johson. As we've talked about for the past couple of weeks, Maine CDC has been working with our colleagues at the National Guard to help healthcare providers across the state get fit tested. Overall, by the end of today, nearly 1,000 healthcare providers in Maine will have undergone fit testing training. This will allow them to make use of N95 masks. But again, the work of the National Guard is not done. They have at least an additional 300 individuals who are on the schedule to receive fit testing training over the next couple of days. And as more individuals sign up, we know that the Guard is standing ready to assist with that process. And finally, a quick update on our shipments of PPE. Just yesterday alone, Maine CDC, working with our colleagues at the Department of Transportation as well as with the National Guard, shipped out 65,000 pieces of PPE just yesterday alone. The bulk of that PPE distribution just yesterday, 86% of it, went to congregate care settings across the state. We're continuing that work. Today alone, there are nearly 30 orders of PPE that will be shipped, again, principally to congregate care settings like nursing homes and long-term care facilities, as well as to locally based fire, rescue, and EMS providers across the state. So thank you very much, everyone. I'd like to turn things over to Commissioner Johson.
Great. Thank you, Dr. Shah. Good afternoon, everyone. Today, with the support of the governor, we're announcing a few updates to the plan to restart Maine's economy. In advance of Memorial Day weekend, we are accelerating the reopening of campgrounds and RV parks for Maine residents. Studies indicate that outdoor activities are safer than indoor activities, and Maine is blessed with some of the most beautiful places to enjoy the outdoors. Maine has a long-standing tradition of embracing the outdoors, which also has the added benefit of promoting mental health during this global pandemic. We've got a short season to enjoy some of our favorite outdoor activities. As a result, campgrounds and RV parks, which were originally scheduled to reopen on June 1st as part of Stage 2, may now reopen this Friday, May 22nd, for Maine residents only. Campgrounds that choose to reopen to Maine residents must commit to following the added health and safety precautions identified in the COVID-19 prevention checklist. The prevention checklist was posted last week. That checklist, developed in close partnership with the industry, ensures that campgrounds operate in as safe a manner as possible with added physical distancing requirements and new protocols and cleaning procedures. Additionally, the administration today is also delaying the full reopening of gyms and fitness centers originally scheduled for June 1. The decision to delay full reopening comes in light of new studies raising concerns about the likelihood of greater transmission of the virus in these settings due to larger numbers of people in relatively small spaces with moist, warm atmospheres coupled with turbulent airflow generated by intense physical exercise. That said, gyms and fitness centers are currently allowed to conduct outside classes of less than 10 participants and one-on-one instruction inside. This restricted level of activity is still permitted, and we've been impressed by the creativity of gym owners across the state who have been adapting to protect the health of their staff and clients. Lastly, the administration is also delaying the reopening of nail salons, also originally scheduled for June 1. This comes after the state of California identified the establishments as a source of COVID-19 community transmission. While claims continue to be reviewed, some preliminary evidence suggests that the close face-to-face contact between clients and professionals could enhance the risk of transmission. Maine is assessing such evidence, but believe it would be appropriate to delay the reopening of these businesses for the meantime. As Governor Mills has said, we guide our efforts based on public health We utilize the latest scientific research, leverage lessons learned from other states, and best practices being developed nationally and locally in collaboration with businesses. We recognize the effects restarting the economy has on business owners, employees, and residents, but we believe these updates are in the best interest of the health of Maine people. And with that, Dr. Shah, I think we'll open to questions.
Yes, absolutely. Commissioner Johson, Commissioner Lambrew, and I are happy to take questions from our colleagues in the media. And we start today off with a question from TJ Tremble from ABC 7.
Good afternoon. Commissioner Johson, you mentioned, actually the press release that was just received said that the 1st of June would be the date when you would announce when the gyms and fitness centers and nail salons might be able to be reopened. Do you have any further information on what criteria you might be looking at?
We don't. We're reviewing, and actually I would defer this to Commissioner Lambrew. This is really her area of expertise, but Commissioner, do you want to come take this one?
Thank you for that question. No, we are working hand in glove with the public health, the evidence and academics, and our friends in the economic community to figure out that balance. There's been a recent study about what's been going on with gyms in different countries. I don't know, Dr. Shah, if you want to talk about that study?
Sure. So, TJ, you know, as everyone is aware, this is a rapidly changing scientific environment. And as a result of that, when new data come out, we try to look at our own policies and adjust accordingly. And just a few days ago, in one of the CDC's journals, Emerging Infectious Diseases, there was a paper published from our colleagues in South Korea documenting a high number of cases, 112 in total, that were found to be associated with fitness classes in a city in South Korea. They attributed the increase in the number of cases in those classes to the fact that it was folks exercising, and this is a respiratory virus. It's a virus that comes out of your lungs and gets transmitted through the air, and when you've got other people around you who are exercising and thus taking deep breaths in, it's postulated that the possibility of transmission is greater. When we saw these data, we evaluated them against our current plans, and as a result of that, we're incorporating the latest science. This is an example of us following the data based on where it's taking us.
Sure. And we will continue to look at both what's going on in different states as well as best practices. We appreciate the fact that gym owners and nail salon owners want to do what's right for their workers and their clients. So we will continue to see if there are, in states that have reopened gyms and nail salons, whether there are best practices that we could adopt to safely reopen these sectors.
Is there any consideration to stepping back and closing the fitness centers and gyms that are open right now?
So currently, the gyms and fitness centers that are open only for 2 types of activities. One is outdoor classes with the kind of physical distancing that will prevent the transmission that Dr. Shah just discussed. Second is one-on-one engagement, again, with that kind of physical distancing. So we have not to date, seen evidence that there's a challenge or a problem with that type of engagement. And as Commissioner Johson said, we want to encourage people to exercise. We want them to get outdoors. It's important to your physical health, to your mental health, to your overall well-being to be able to exercise. So we want to find a way to prevent the spread of COVID-19, but to promote health as well.
Thank you.
Great, thank you, TJ. We're going to turn next to Joe Glauber from WMTW.
Hi, thank you. I have 2 questions. The first for Dr. Shah. You had mentioned that you'd be announcing more in regards to 100 State Street, but I wanted to ask whether this was a situation where universal testing was being considered or whether that would be different because it doesn't fall into the category of congregate care facilities and things like that, even though, as you mentioned, there are some high risk or residents or those with specific needs within that complex.
Sure. So Joe asks about 100 State Street and how we're approaching and how we're thinking about offering testing there. Joe, as you noted, this doesn't fit into the classic definition of a congregate care setting. For that, we usually think about a nursing home or something of that nature where there's a high degree of interaction between, say, nurses and patients. But we also recognize that the residents at 100 State Street are medically vulnerable. And so although what we're thinking about this as is offering testing to every single resident who's there to make sure that if they would like to be tested, they've got the opportunity to. Functionally, it's equivalent to universal testing, but when we think about universal testing, we usually think about it in the context of congregate setting. But functionally, these two are the same thing. We want to offer testing to every single individual who resides there because we know that they have pre-existing conditions that could put them at risk, and that's the approach that we're taking right now.
Thank you, Dr. Shah. And my second is perhaps for Commissioner Johson. I was wondering if you could offer any detail in regards to what, in terms of reopening plans, qualifies as a restaurant, and are there any specific qualifications, and would places, perhaps like an American Legion, for example, where that may serve food, would those fall into that category, or is there a specific place where the line is drawn in terms of reopening?
Yeah, so thank you for the question about restaurants. And restaurants are licensed and have a state license that has a restaurant designation. So there's a fairly clear line about what a restaurant is. If an establishment has a restaurant license, then they are able to open under the new guidelines.
Mm-hmm. Great, thank you.
If they weren't registered as such, that they would not be able to?
If they don't have a restaurant license, then they would be in one of the other categories that are a little bit later in the reopening phases.
Very good, thank you.
Great, thanks, Joe. I see that Colonel Don Kerrigan is back with us today. Go ahead, Don.
Thank you, Dr. Shah. I appreciate the increase. I have a question first for Commissioner Lambrew regarding mental health. And I know we've had discussion multiple times in the last couple months that they're expecting an increase in mental health needs, people needing mental health treatment of one kind or another as a result of the COVID-19 situation. My question for the Commissioner is, have we seen any significant evidence of that? And specifically, what is the state doing to expand mental health treatment to address this?
Sure. So the state of Maine remains concerned, as do most states, as do people throughout the world, about the mental health impact of COVID-19. We have been tracking to see what's going on in terms of calls to our 211 line, in terms of our own utilization data, and we have seen an increase in the number of people calling related to mental health concerns. We have seen some, albeit small, increase in the number of suicides in Maine. We also have seen both a decrease in in-person mental health engagement, but decrease in in-person, but an increase in telehealth. We've seen dramatically big jumps in the number of people seeing a mental health provider by phone, by video chat, which is encouraging. All that said, that's not enough. We are grateful that we're going to be receiving a grant through FEMA for mental health in this disaster that we will use primarily for a public education campaign to make sure that people are connecting to the resources that we have. We are also trying to see if there's any innovative engagement we can have with our own behavioral health providers so they will be able to better serve people in the state at this time.
Thank you. And for Dr. Shah, you've continued to talk about testing, which obviously is a great concern. The governor yesterday said that she thought we needed more testing to better know what it's safe to do and to not do. Have you either instructed or strongly suggested the private labs in the state, including the hospitals, adopt the IDEX testing materials and expand their testing as CDC has, using those IDEX tests to have a unified statewide expansion?
Sure. So Don asks about whether there's additional capacity for hospitals and other institutions across Maine to potentially use the same IDEX testing platform that we're using at the Maine CDC lab. And Don, the answer is perhaps a bit uninspiring. A lot of the reason that we were able to utilize the IDEX platform was we already had some of the machines. They're manufactured by a company called Thermo Fisher. we already used some of the machines that the IDEX test was designed for. In addition to that, IDEX themselves lent us an additional Thermo Fisher machine to boost our capacity. This is a machine that our staff at Maine CDC were aware of and knew how to use. Not too many other facilities across the state. Actually, we actually talked about this morning, almost an identical question to the one you raised, Don. We're not aware of other facilities across the state that happen to also use the same Thermo Fisher platform. There may be one, and if so, we'll stand corrected, but we're not aware of any other facility that uses this specific machine that the IDEX test was designed for. It's a machine called a Kingfisher. Unless they have that machine, it's not so easy to go out and adopt the IDEX test. In addition to that, what greatly complicates the matter is that there's a very lengthy back order from the manufacturer. So even if a hospital in Maine right now wanted to obtain one of these so that they could use the IDEX test, there's a very lengthy back order. So we've thought about that exact issue, Don, because again, the more testing that can be done at the table, the better. But those were the speed bumps that we ran into.
So a quick follow, if I could. So, what is the alternative for them to expand further?
Great. So, I mean, good question, good follow up. The first one I just want to underscore, we've thought about this almost exact issue, and that was what we encountered. So then the question is, what other alternatives are there for there to be expanded testing? And there is some better news on the horizon. So perhaps this is a more inspiring end. Every day there are more and different types of tests that are receiving FDA emergency use authorization. A lot of those new tests can be run on existing pieces of equipment. So what we're doing as part of a laboratory testing group that meets, I believe, every Thursday morning, members of the Maine CDC laboratory are on that meeting. We're working to provide technical assistance with those other laboratories across the state to make sure that they've got the latest data on what tests have been approved by FDA and how they might look to bring those on. What I will say, Don, is on top of that, there are additional modalities that are getting approved by FDA, such as saliva-based testing, in-home testing. All of those things are changing on a daily basis. We're trying to work with hospital and medical colleagues to keep them apprised of what the latest is. All that being said, Don, I will say that the number of hospitals across the state that are offering testing is growing day by day, week by week. I think folks have heard me mention that a few days ago, I had a call with the CEO of Cary Medical Center up in Caribou. They are offering and providing testing for COVID-19 within their own hospital. So they don't need to send samples to Augusta or even elsewhere. They can do it within the hospital. So certainly the ability of hospitals to provide testing is expanding across the state.
Thank you.
You bet, Don. We will turn now to Jessica Piper at the BDN.
Hi, Dr. Shah. A couple of questions for you, and Commissioner Lambrew is welcome to weigh in as well. First, on the issue of testing, we have heard from some healthcare providers that aren't expanding testing because they don't have enough swabs, medium, and test kits to take patient samples to then send to you at the state lab. How will the state expand testing when local providers can't accommodate all the requests? And does the state anticipate being able to assist providers with these sorts of supplies anytime soon?
Sure. So Jessica's first question is about the other supplies that are needed in order to conduct testing. Having the tests be available at our laboratory is step one, but there are other steps that need to be undertaken. We've heard the same thing, Jessica, and nationally, as well as in the state of Maine, there unfortunately have been shortages of two of the necessary pieces. The swabs that go in your nose to take the sample, and then the test tubes and the what's called transport media that the swab goes into in order to prepare it for shipping to Augusta. There have been nationwide shortages of those. A few days ago, Maine CDC received very large shipments of both swabs and transport media from our counterparts, our colleagues over at FEMA. I think we received those just a couple of days ago. And today alone, all of our inventory that we received are being shipped out across the state. We're shipping out a total of 19 orders comprising thousands and thousands of swabs, as well as thousands and thousands of vials of transport media to a variety of healthcare providers across the state. Hospitals, long-term care facilities, skilled nursing facilities, and outpatient clinics across the state are receiving those, and we put those on an ASAP delivery. So probably by the time we're done with this press conference, those materials will have been delivered across the state to remedy the exact issue that you note.
Okay, and then second question. On the issue of nursing homes and assisted living facilities, which are obviously some of the most vulnerable locations, with this expanded testing, is the CDC thinking at all about ways to potentially allow limited family contact for individuals in those settings who might have gone a while without seeing family?
Got it.
And
Go ahead, Commissioner.
And I'm happy to answer this question about what, if anything, are we doing to ensure families can visit with relatives in nursing facilities. From day one, this has been a concern for us. We recognize that many people in nursing facilities want to see their relatives. They communicate best with their relatives. They often struggle to adhere to the types of recommendations that they need to stay well without their family close by. So we have both balanced out the restrictions to ensure that those visits do not bring COVID-19 into these vulnerable sites, with a requirement that nursing facilities do, for example, have a glass window where a relative can see their loved one through the glass and have that physical viewing of their relative, using the phone, using FaceTime, using all those devices. There is new guidance from the Centers for Medicare and Medicaid Services that came out yesterday that begins to talk about how can we, as COVID-19 spread declines, begin to change our nursing facility recommendations. We are studying those recommendations now, but in the state of Maine is premature. We continue to ensure that our nursing facilities both provide the compassionate care as well as the infection control that they've been doing, as well as making sure those relationships maintain during this difficult time.
Mm-hmm. It's an incredibly difficult balance to strike between allowing friends and family to go and visit their loved ones and advocate for them and create that social and emotional bond versus making sure they stay safe.
Yeah.
So, Jessica, did you have were those your two questions?
Yeah, you can move on.
Great, thank you. We're going to turn next to Patty White over at Maine Public.
Hi, thanks so much. I've got a couple questions. And Dr. Shah, I was wondering, now that we've expanded testing capacity, what's the biggest constraint that we're facing from a public health perspective? Is it PPE? Is it hiring contact tracers? Like, what's the kind of the next hurdle we need to get over?
So Patty, that's a really great question. We've been thinking about that, talking about it internally. Just to cut straight to the chase, I think where we're going from a strategic perspective and what the next wave or concerns of COVID-19 response look like are a few things. The first is, early on, we talked a lot about flattening the curve and raising the line. That is to say, preventing overwhelming of the healthcare system so that hospitals can continue caring for patients. We've achieved that. Now we have to talk less about mitigation, which was what that discussion was about, and to start thinking more about suppression. And that involves a few things. One is contact tracing. We've been steadily increasing the number of individuals who have been working on contact tracing, initially by redeploying staff from within Maine CDC, and now as we look to bringing on volunteers and full-time staff to build out that force of contact tracers so that someone who's identified as being positive can be provided with safe isolation so they don't spread it to others. That's a really big piece of where we need to be going, and it's one of our hurdles that we have to overcome next. The second big piece is thinking about other approaches toward congregate settings, whether that's nursing homes, whether that's correctional facilities, whether that's any other type of setting where a large number of people come into frequent contact with a stream of insiders and outsiders who are interacting with them. As we've all seen, that has been a source of infections and outbreaks, not just in the state of Maine, but across the country. I think for us, that's what we're really thinking about doing. One of the things that we've seen with COVID-19 is that one case can quickly become other cases. The way I think about it myself is, it's as if you accidentally spilled some glitter in one part of your house. The next thing you know, you're in the third floor attic and you somehow or other find glitter there, even though you spilled it in the basement 5 or 6 days ago. And what we've seen with COVID-19 is that it operates a little bit like that glitter. It finds its way across the state. And one of the ways that it does so is through those congregate settings. And so one of our approaches, what we're thinking about now, is how can we get a better handle on those congregate settings, particularly in looking at ways that we can limit spread related to them. So it's really, those are the two things that are top of mind for us, at least from a public health perspective.
Great. And just to follow up on that, in terms of the congregate care settings, I mean, you've announced, I think, 2 nursing homes where the outbreaks have been resolved. Did you learn anything from, are those nursing homes now doing anything differently that other nursing homes should maybe, they can take lessons from and start doing to kind of prevent outbreaks? Yeah,
that's, Patty, that's a good question. I'll invite the commissioner up here as well. And the reason I pause for a moment is I just want to be clear. Even though a nursing facility may have gone through an outbreak, we want to be clear. We're not suggesting that there was a specific issue or a specific lapse that could have resulted from that, sure. or could have led to that. That's not the function of the public health investigation piece. But Commissioner?
Sure. So we continue to work with nursing facilities and assisted living facilities and our group homes throughout our state to, number one, make sure the emergency rules that we did about a month ago work. We'll be seeking comment on them, potentially finalizing them for the long haul to make sure that we are always going to be on vigilance on infection prevention and control in nursing facilities. But second, we continue education and engagement. We, for example, have been working with assisted living facilities and are thinking through, is there something else we can be doing in terms of regulation? Same with our private non-medical group homes. Is there something more we can do on infection control with them? But a lot of it is just education. Mm-hmm. I know this Friday we're going to be doing a town hall call with a lot of direct care workers who are on the front lines to give them the tools they need to protect themselves, to protect their patients. We'll be doing another town hall meeting next week with many of these providers to, again, give them the information and tools because they are as motivated as we are to keep everybody in Maine safe.
Mm-hmm. Great. Thank you, Patty. Did you have anything else, Patty?
Sure. Actually, if I could ask one question of Commissioner Johson. It's about the 14-day quarantine, and I'm just curious what the expectation is for lodging operators. They have the requirement that guests from out of state are supposed to quarantine for 14 days beforehand, and you've said it's an honor system, but is the expectation that they just need to ask the question and then just accept whatever answer they get, or is more vetting required?
Yeah, so thanks for the question. We're getting a lot of questions about quarantine, and again, we want to reiterate, quarantine is one tool, and we continue to look for other options to really keep Maine residents safe, tourists safe, and allow capacity in our tourism economy. So that work is ongoing. Quarantine is a piece of that. It at least currently is something that there's a lot of discussion about. There's more work being done on enforcement of quarantine as well. I expect you'll hear more about that kind of over the coming next week or two. But yes, we certainly expect most people will want to follow the rules, right, and keep people around them safe. We've heard a lot from tourism studies that people only want to come to markets where they do feel safe and they do feel like that state is protecting the tourists that are coming to visit. So, I think it's in all of our best interest, but again, we certainly need some additional work there, and that work is going on.
Great. Thanks a lot, Patty. We're going to turn next to Kevin Miller at the Press Herald.
Great, thank you very much. So first question for you, Dr. Shah, and then one for Commissioner Lambrew. So you mentioned at the State Street complex that the testing being done there is, you said it was functionally the same as at congregate settings. Can you explain that a little bit more? I mean, because what it sounds like you were saying is that you're offering this testing to residents, so it's certainly not required. Is there some sort of a challenge where Maine CDC doesn't have as much ability to go in and not that you can require anyone to do testing, but can go in and do universal testing in a facility like this versus a nursing home? Can you just explain that a little more?
Yeah. So Kevin asks about our plans right now at 100 State Street. And Kevin, you did put your finger on several of the distinctions. The first is that this is not a licensed healthcare facility. And so that means that anything that we do would be in concert with the managers, the operators, as opposed to, say, a long-term care facility, which is licensed by the department, et cetera. The second distinction is that in congregate care settings where we typically where we typically do offer universal testing, those are usually healthcare settings. Long-term care facilities, assisted living facilities, places where there are healthcare staff who are there who can administer the testing. And so that's another reason here this is not a fully medically staffed facility. It's more akin to an apartment building as opposed to a congregate care setting. And so for those reasons, what we're really thinking about is making sure that testing is fully available. We're thinking about something in a lobby where all residents are aware that nurses will be there and offering testing, as opposed to what we might do, say, at a nursing home, where we're really going around bed by bed and strongly recommending it, or having the staff at the facility strongly recommend testing. Here, we're not even at this stage. The purpose of this exercise is to determine whether there is an outbreak happening before we get other epidemiological evidence. As with any apartment building, even though there may be 3 or more cases, we still haven't established yet whether there's an epidemiological link. And so rather than waiting until we get to that stage, given the medical vulnerability of the individuals who reside in this residence, we thought we'd act and make sure we offered testing. Commissioner?
I would just add, when you think about testing, it's kind of like a pyramid. We started out with our tiers because we had limited capacity, so we were testing symptomatic people in 6 categories of vulnerability. We also were doing universal testings in facilities, in congregate living facilities with an outbreak, because that is top tier. We moved down yesterday in a very exciting way to be able to test asymptomatic people suspected of COVID-19 and in certain circumstances in consultation with our clinicians. We are getting to a point where our testing capacity allows targeted testing, sentinel testing, other types of testing, and we continue to work on a plan that maximizes the testing capacity we have for public health.
I think it's fair to say that the offering that we're going to be making in concert with 100 State Street is a direct function of our increased testing capacity at the Maine CDC laboratory. I don't know that we would have been able to undertake this just a few days ago. And Kevin, I think you also had a question for the commissioner as well.
Yeah, for Commissioner Lambrew. I'm curious about the decision to delay the nail salons. I think myself and probably some others out there might look at that and say, well, how is that really different as far as the close contact that a person would have with a client? How is that different than a hair salon or a barber, which are being allowed to open? Why is there a difference between a nail salon and a hair salon? Both cases, you're very close to the client.
Yeah, so we've had much debate on this, and we are still reviewing. I want to be perfectly clear. We continue to look at all of our evidence to find out both what is best practice from states where nail salons have opened up, as well as what does our own community say about how we do this. So this is a half step to pause, to take a look. But I think if you follow what's been going on in different states, we heard the governor of California say that he believes that community transmission began in a nail salon. I know they're, again, looking to see what is the evidence in California, what's going on there. We're looking at what's going on in California, but we're simultaneously trying to balance out the risk of spread. As a reminder, in nail salons, it is face-to-face. There is somebody you are looking at, and if this is a aerosolized respiratory disease, that may pose more risk than people in proximate settings, but maybe not as close in your face as others. All that said, we continue to look, to study, and to see what we can do. We thought it was prudent to take this half step now.
Thanks.
Great, thank you so much.
You bet, Kevin. Thank you. We're going to turn to Michael Fern at the Maine Edge.
Thank you, Dr. Shah. My questions are for you and Commissioner Johson. Dr. Shah, what percentage of new cases in the 4 community transmission counties are actually untraceable in the last 2 weeks? I think you said most have been proximity cases.
So of the cases that we've observed and that have been reported positive in the past, say, week and a half to 2 weeks, what we've really seen are a significant number of cases that are linked to household transmission or close contact with a known case that typically nowadays occurs most commonly in households. I don't have the exact number with me right now, but that's certainly been the lion's share of cases just in the past week or two, which is to say individuals who go back, who have been confirmed, and then go back to their household setting and may interact with a spouse, a roommate, something of that sort.
All right, thank you. And Commissioner Johnston, this is a repeat question from last few weeks back. Do you know how many businesses have closed, or have a sense of how many will lose across the state? Thank you.
Yeah, and we don't have a good sense for that yet. We continue to try to find this balance between public health and economic health and create creative bridges for businesses where we can. I think gyms is a great example, right? We certainly have had some concern as it relates to gyms, but gym owners found this creative path around outdoor classrooms and one-on-one settings that try to protect both the gym owner and the person. So while some of these solutions aren't ideal, they are intended to be bridges forward for businesses and trying to capture as many of them as possible. So we are incredibly concerned, right, about businesses and the business outcomes, and we continue to work closely with them in parallel to trying to manage the public health issues as well.
Great. Thanks, Michael. We're going to turn over to Brad Rogers. Brad, I hope you're feeling good today. Hope you're feeling better.
Yes, thanks very much. I appreciate it. Well, I've got two questions. First, for Commissioner Johnston, is there any plan to move up the timetable at all for lodging in Maine, either maybe in the rural areas or elsewhere? And I only say that because it seems like restaurants, and I realize that if you open up lodging, it's going to mean a lot of out-of-staters flooding the state, but it seems like it would be more social distancing, I think, in a hotel than there would be in a restaurant.
Yeah, so Brad, thank you for the question. I'm not sure if people could hear. I couldn't hear Brad very well, so let me reiterate the question. He asked about pulling forward timing for lodging. So again, we continue to evaluate this on a daily basis and understand any new science that's available, as well as additional opportunities for economic moves forward. And today you saw a little bit of balance of both of those, right? The science moved some in a little bit of a more cautious tone, and maybe created opportunity for us to pull campgrounds and RV parks forward to open those a little bit earlier. So we review that every day. Again, tourism is something that we are looking at holistically. We're looking at it regionally as well, and in discussions with Massachusetts and New Hampshire and Vermont, looking at kind of what their standards are and their path forward to try to find this safe equation for Maine residents and tourists, because we think protecting tourists is also a real responsibility that we have and a critical part of how we support that economy, both short and long term. So, the lodging guidance is ready. Lodging and hotels have had some great ideas about how to do this safely. Again, though, we're trying to balance this traffic flow of people coming into areas that they might not be from and integrating into different communities. And so there's a lot of work there still to be done.
Okay, thanks very much. And Dr. Shah, in speaking with physicians over the weekend, has there been any positive results yet from the drug remdesivir?
So Brad asks about the early results from remdesivir here in Maine. As I noted, I did have an opportunity to catch up with a fair number of physicians on Saturday. The drug has been used, Brad, but it's too early to know exactly what impact it might have had on any particular patient. The reason I say that is that the best data that we've got on remdesivir are that it, at most, based on what we know right now, can shorten the number of days that someone is in the hospital for. The one study that Dr. Fauci himself and his group were involved in suggested it could shorten the number of days from around 15 days to about 11. And so as a result of that, it takes a number of days, Brad, before you can look back and say, aha, that patient I thought was going to be in the hospital for 14 or 15 days, but lo and behold, because of remdesivir, maybe they were out a fewer number of days. It's too early to tell at this stage whether it's had that effect. We're continuing those calls with clinicians to keep tabs on what their thoughts are. You bet. And today's last question goes to Emily Tadlock at WABI.
Hi, thanks so much. So my first question is for the Commissioner Johnston. I wanted to know more about some of the things that you guys that folks can actually expect to be different at campgrounds? I know you're going to refer me to the checklist, but like a lot of my colleagues, we live off of sound bites. And so I'd love to hear something from you about what people can expect will be different if they decide to go camping on Memorial Day.
Yeah, Emily, thanks for the question. What's different is the congregating activities in a campground, right? Campgrounds will have very specific protocols, but what is the same is this opportunity to get outside and experience some of the great Maine assets we have, right? Hiking, fishing, just a chance to be somewhere different potentially. We're hearing from a lot of people, right, that are seasonal campers, and Memorial Day is the kickoff to their summer and the kickoff to their move into their seasonal campground location. And so, I think that will remain the same. Again, things that will be different are no gatherings larger than 10. There will be distance between campsites that maybe weren't there before. Some of the congregate spaces will be closed. And I think some of the cleaning procedures will be different. So a number of things will be different. We hope that there are enough things the same that people can really enjoy the outdoors and do it safely.
Shah, for those people who are talking about going camping on Memorial Day with their family, what can they personally do if they decide to visit these campgrounds to keep themselves and their family safe?
Well, Emily asks about, from a health perspective, what can folks who are Maine people who are going out and visiting campgrounds this weekend do to stay personally safe? The health advice dovetails perfectly with the advice that Commissioner Johson and the teams have put together in the checklist. And there are two things that I would recommend, Emily. The first is to stay with your household. Even though a lot of the opportunities for congregate settings across households will be removed, it's still a good opportunity to stay with your household to make sure that you're not interacting with other folks who you never know what their COVID exposure might be. So staying within your household is one of the best ways to stay safe. But the other thing is, even though COVID-19 is the topic of the day, we're still in the midst, or now starting to be in the midst of tick season. Mosquitoes are still out there. There are a number of other health hazards that I would be remiss if I didn't also recommend folks keep in mind. So as you're going out this weekend to enjoy nature, make sure you're also not forgetting about non-COVID health risks. So please make sure you're covering up your arms and legs, tucking your pants into your socks, wearing insect repellent to try to stay safe from the other things that are out there as well. So, Commissioner, did you have anything else?
I guess the insects will be just like every other year.
The insects and the ticks will be like every other year,
Yeah.
just to stay fierce.
So I just wanted to put a point of clarification as well. Thank you to Commissioner Lambrew. This is private campgrounds, not state park campgrounds. State park campgrounds will open on June 1st as originally planned. And private campgrounds will open at their discretion. So I would say if you have a seasonal campground, make sure you call ahead first and understand their situations and the check-in processes.
Great. All right. Commissioner, anything else?
No, I think that's it.
Okay, great. Well, we thank everyone for joining us this afternoon. We appreciate the opportunity to brief everyone across the state on where things stand with COVID-19. Thank you all so much. Be safe. Enjoy the glorious weather this afternoon, and we'll talk tomorrow. Thank you.